depression, anxiety, obesity, autoimmune disease, dementia, fatigue, inflammation, food reactions, IBS. Did you know that every single condition I just mentioned is linked to an imbalanced microbiome? That means the bacteria living in your gut are causing health or disease. Because of our modern lifestyle, we are now in the midst of a mass extinction of critically important gut bacteria, and due to this, we are seeing astronomical levels of preventable diseases. Now more than ever, the single most important thing you can do for your health is to restore your microbiome. And here's the good news. You can regrow and rewild your microbiome for improved digestion and reducing inflammation, enhancing immunity and your mood, better metabolism, and weight control. I'm Dr. Nirala Jacobi, and for the past 25 years, I've helped thousands of people improve their gut microbiome through my gut health clinic and online courses. And now I'm sharing my knowledge with you. I've created the Restore Your Microbiome course that gives you cutting-edge microbiome science in easy-to-understand lessons and resources you can put into action straight away. Learn which foods are packed with the most important fuel for your good gut bugs and which to avoid to prevent bad bacterial overgrowth. Which easy lifestyle changes drastically improve the health of your microbiome. Which microbiome testing I recommend so you can be absolutely precise with your microbiome regrowing strategy. Let's be honest, you've probably heard about how important your gut microbiome is to your health, but you have no idea where to start. I'm here to help. Sign up now and start restoring your gut microbiome to live your best life. Good morning, Australia, and good afternoon, America, and good evening, Europe. We're so stoked and excited to have released now finally the Restore Your Microbiome course. This has been a course that's been years in the making, and very, very happy to finally put it out into the world. So many people are writing to us with a request for a course like this because I think everyone realizes the importance of a healthy microbiome. So I thought I would answer some questions. A lot of questions have come through because people didn't have the time to tune in. Thank you for joining Instagram. And yes, so let's start with some with some questions that have come through before. Some of them I will summarize because people understandably have a lot of stuff going on with their digestive tract and with their health in general. And so there were a lot of questions that were specifically case related. So I'll try to summarize those a bit towards the end. But the first question is, I have a question about lifetime antibiotic use and trying to restore the microbiome. I have to take prophylactic antibiotics every day after an organ transplant to help reduce pathogen load in the body. Is there a way to restore gut health in this circumstance? And I'll be honest, it's very difficult if you are on antibiotics forever and chronically. But it's not completely impossible. There are a lot of things, especially for you who is on antibiotics, you need to do extra steps to protect your microbiome. And I think there will be a future where we will have more FMT or fecal microbiota transplants available. I believe in the future, it's not there yet. Fecal microbiota transplants is basically fecal material in a capsule that are very specifically regrowing a microbiome. Here's the issue with regrowing your microbiome. You can't just take probiotics or just eat fermented foods and hope that those bacteria will rewild your microbiome. That's not how it works. You have to, when you think about your microbiome, 90% of your microbiome is basically this anaerobic mass that is falling into just a few groups of bacteria that we cannot give probiotics. This is not like in a probiotic. Probiotics are live organisms that can survive in air, and the majority of your microbiome is actually what we call anaerobic, so is not exposed to air because it would die. That's what is, you can't just take capsules. You have to really feed the garden, as I call it, with foods and with the lifestyle that you lead. And that's really what this course is about. It's about you learning strategies that go beyond just supplementation and really understanding what you're dealing with right now. And in this course, I talk about the testing that I recommend to really understand and get a broader view of your microbiome rather than just do the normal eat more fiber, right? It goes beyond that because you need to know your specific microbiome pattern. So the question about whilst you're taking antibiotic, you still have to feed good bacteria. So, but it's a great question because a lot of people are on antibiotics, sometimes chronically. For Lyme disease, for example, I had a lot of patients that I saw in my practice that have been on years of antibiotics for Lyme disease treatment. And it's challenging, but you know, it can be done, but be patient because just like watching a garden regrow, it goes slowly, but it can be done. So yes, I do recommend the course for anyone who's on chronic antibiotic use. Next question, is this course suited if you still have Sibo? Fantastic question. A lot of people know me from my work in Sibo. So I fully get it that you wouldn't want to feed bacteria while you're actively having Sibo. So I make that very clear in my course, and also tell my patients this course is for you if you have cleared Sibo or when you have cleared Sibo. So the course for you if you are having Sibo is the Sibo Success Plan that you can find on the Sibo Doctor as well. And this microbiome restoration course is after you've cleared Sibo. Because it makes sense, right? You don't want to feed the bacteria. You want to first rebalance the bacteria or kill the bacteria in your small intestine, but then feed the bacteria in your large intestine afterwards. So the large intestine is where your microbiome lives, right? That's where you have this incredible organ that does all these amazing things for you. So you can really feed that after you have cleared Sibo. Next question, is this course designed for practitioners or patients? Also, excellent question. So this course, let me back up. A lot of you know me as an educator, so I've created a lot of courses, and one of the feedback, or most common feedback I get for my courses is how comprehensive and how much information I cram into this course. And that is because I want you to I want you to have all of the material that's important for you, regardless of if you well, I make it understandable, but I don't dumb it down, right? I don't just give you basic information because let's face it, there's a lot of that on the internet, and that's not what I'm about. I'm about really giving you the most information, and that means some of it will be challenging, and so you have to maybe listen to the material or pause it and read the transcript or really see so basically the point is that it is somewhere between patient and practitioner, or layperson and practitioners. That's what I've geared for it, because there's also a lot of practitioners who have just basic knowledge of microbiome science. So I have made this course also for them to kind of get a good foundation on microbiome science. So it is a great course if you want to be understanding metabolites, right? So understanding inflammatory metabolites and what that means and how to address that, and how to not just kill bad bacteria, but how do we actually manage these metabolites. The course has 5 modules. Module number 1 is what is the microbiome? Basic understanding of the different groups of bacteria. Number 2 is testing. What kind of markers are we looking for? What are we testing for? How can we monitor this? module number 3 is what harms the microbiome? What lifestyle factors are contributing to a demise of your microbiome? What medications, what foods? So really important, because not just about what can you take to regrow it, but what can you stop doing to stop harming it. Lesson 4 is basically weed, seed, and feed. So weeding out bad bacteria, seeding, which is sort of technically not quite correct. We don't seed bacteria, but we're kind of promoting the growth of beneficial bacteria. And I explain why that's a bit of a misnomer in the course. And lesson 5 is all about the microbiome regrowing diet, right? So it's a really comprehensive course from that perspective. Okay, next question. So the basic answer, sorry, it's a bit early in Sydney. We were up late with finishing touches on this course last night. So I'm a bit discombobulated, but basically the course is a great foundation for practitioners who have basic understanding of the microbiome and want to understand how to improve it for their patients. Also, I keep having recurring Sibo. I have had a few rounds of antibiotics ×3, herbal antibiotics ×2, elemental diet ×1. These are all very classic treatment strategies for Sibo. So that's true. And she's also he or she following the biphasic diet protocol to support. Do you have any recommendations on what to try next, currently in menopause with symptoms and also have heavy metals? I'm sorry to hear. You've got a lot going on. But one of the things I miss in this list of treatment strategies is prokinetics. So prokinetics is a class of either herbs or prescription that basically aim to reset the motility of the small intestine. So a lot of times it's not about killing. It's about making sure that the normal motility of the small intestine is restored. So I would consider looking into that and seeing if you have any damage to the motility of the small intestine. And you can do that if you live in America. You can order an IBS Smart blood test that looks for antibodies that could tell you whether or not you have autoimmune IBS, and that will give you an idea as to what kind of prokinetic to use. And I do recommend that you consider doing the Sibo Success Plan on the SiboDoctor.com, and that gives you a lot of information as to also what other things to consider. Next question. Will this course provide information about specific probiotic strains to use during and after Sibo? That's not the course you want. You want the Sibo Success Plan, and that's also on the Sibo Doctor. That is all things Sibo. This is all things microbiome, arguably. That is also related to the small intestine, but this is really intensely focusing on microbiome restoration. And that means large intestinal microbiome restoration, because this is where we want to regrow it. If you think about the two different areas, your large intestine and your small intestine, the small intestine is not meant to have very many bacteria in it at all. Why? Because that's our biggest surface area to digest and absorb nutrients. So you don't want heaps of bacteria there. You want them more towards the end of your small intestine, leading into the large intestine. And then that's where a lot of this magic happens with your microbiome. If you think about in terms of ecosystems, your small intestine is more like a desert and your large intestine is more like a rainforest, right? So we don't want to have overgrowth of bacteria in the desert or in the small intestine, because that is where everything will ferment and cause more symptoms. So we don't really want to do that. Okay, next question. I've heard Sibo is just an imbalance of good bacteria and bad bacteria. I've been trying to kill the bad bacteria, but my symptoms are just getting worse. Can you help me with this imbalance? Yes. So first of all, Sibo it's true. It is sort of an imbalance of good and bad bacteria. We now know that the small intestine, even though we just said it's a desert, it's not a complete desert. Life is still there. So you still have a microbiome that serves a really important function in the small intestine. And when you have an imbalance, like Sibo, you actually have an overgrowth of what we call pathobionts. And I elucidate this very much in the course. The course is all about, teaching you how to really understand this idea of simplification of bad bacteria and good bacteria. Technically, there is no such thing, right? But it's about pathobionts and symbionts. So pathobionts are organisms that are normal in small amounts, but are a problem when they overgrow. And that's the case with Sibo. Sibo is where we have an overgrowth of pathobionts like E. coli and Klebsiella. And then there's a few others like Fusobacterium and Desulfur Vibrio, and you can have imbalances. You can definitely have dysbiosis in the small intestine like that. But the issue is that you do need to control these pathobionts, but you also need to restore motility, because what keeps bacteria in check in the upper gut is the normalization of your what's called the housekeeper wave, which is the migrating motor complex, which is a part of your neurological system in your small intestine. And a lot of people that have Sibo have some damage to this motility. So yes, back to Sibo. Sibo is a different course, right? This is more about when you're done treating Sibo, you want to deal with the imbalances in your large intestine. And if you've tried and tried and tried to kill bacteria with antimicrobials with Sibo, and you've never tested, first of all, a lot of people will tell you have Sibo and just go by symptoms, just treat Sibo, don't test. I would say that's incorrect. Basically, you want to first test to make sure that your symptoms actually are due to Sibo, because you can have IBS symptoms and not have Sibo. And you could have microbial imbalances in the large intestine, and they will give you the exact same symptoms as Sibo: bloating, constipation or diarrhea, cramping, all the rest of it. So make sure that you actually have tested and you have been, you have Sibo. And that's a whole nother talk about accurately interpreting the test results. And I go through that in the Sibo Success Plan, a separate course. All right. I've had diarrhea for a few years now. My doctor said I don't have Sibo. I've tried so many probiotics, but these just make it worse. Is this course going to help me? That's actually a question I summarized. It was a much longer question about, it was just a whole case review. So basically it was diarrhea for a few years now. My doctor said I don't have Sibo. I tried many probiotics, but these just make it worse. This is classic imbalance of your microbiome. So the first thing I would do is to consider doing the stool test to understand what's going on with your microbiome. And the stool test is the microba test that I recommend in this course, in the microbiome restoration course. And the details are on the course page. So when you do some assessment of your microbiome with a stool test, not all tests are the same. I usually, when I do this work, I go with something like Microba because it gives me a good understanding of the diversity. So if you think about your microbial diversity, a good number to shoot for is somewhere between 150 and 300 species. And a lot of people that have chronic gut issues, a lot of digestive dysfunction, a lot of reactions like to probiotics, actually have very, very poor diversity, meaning very few species are in their digestive tract. They may have lots of bacteria, but the number of species is very low. So I kind of think about this as some sort of imbalance like, for example, here in Australia, we have a problem with a pest called a cane toad that was introduced. And so we have lots of them, and it eats the native frogs and things like that. So the diversity is small, but the numbers are big, right? So that's how I think about it, that you just have sort of a bit of a problem with that. So that would be my thought, is that you look into that you may have large intestinal problems that go beyond like Sibo. It might not be Sibo. You might just have this poor diversity. When you have poor microbial diversity, what happens is the bacteria that live in your microbiome that are of different groups, they form networks called bacterial networks, and they feed each other. So meaning the waste of one organism might be the fuel of another, and that's called cross-feeding. And when your diversity goes down, you lose some of these bacterial connections, and then it's very possible that you get symptoms that are more difficult to treat, and you need to be patient with it. But this course is perfect for you. If you've got any sort of microbial issue like that, this is the perfect course. Okay, next question. I have a lot of gut symptoms since I took 3 rounds of antibiotics back to back. 3 years ago, I had a terrible sinus infection that just wouldn't go away. My doctor kept prescribing antibiotics. My gut has not been the same since. Lots of gas and bloating with pretty much anything I eat. I tried so many supplements and nothing works. I believe my microbiome is dead. So many so-called gut experts online say you should eat more fiber, but every time I try this, I get so constipated and bloating. How can I help my microbiome without fiber? So first of all, your microbiome is not dead. That's not true. But this is classic. This is like the first case I talked about. So many antibiotics, right? For sinus, for bladder infections, for chest infections. We get so many antibiotics that can harm the microbiome. And oftentimes when you have a chronic sinus infection that's not treatable with antibiotics, I would not continue with antibiotics. I would look at potential fungal contributors, because even when you look at the Mayo Clinic website, which is a big multi-clinic center in America that is sort of specializing, I would say, that website says that something like 90% of all chronic sinus issues are usually, fungally related. So that might be your problem, is that you're treating the wrong organism, because antibiotics won't kill a fungus. They make that worse. Also, the gas and bloating with anything you eat, that's also classic microbial imbalances. Tried so many supplements, nothing works. And that's where you really have to start looking at what's happening in these microbial communities called your microbiome. So yes, this microbiome course is for you. Also, if you feel like fiber is adversely affecting you, so giving you more symptoms, first of all, that's a possibility for Sibo, so consider that. But so make sure you've ruled that out. But at the same time, when you have really poor diversity, this is commonly the case, where you just say, or where you noticing that fiber, anytime you eat fibery foods like legumes, beans, you're getting more gas and things like that. That is not uncommon, because most of the time when people have this issue, they say they've avoided fiber and they've avoided legumes. And so what happens is you're not training this muscle to help you, which is, it's not really a muscle, but you're basically making the situation worse by never eating fiber. So more and more your fiber fermenting bacteria will go down. And so every time you eat fiber, it just gets worse and worse. So I have tips and strategies in the microbiome restoration course that basically give you some tips on how to make fiber more digestible, because you can sort of ease into this process. When you have very, very poor diversity, just loading your system up with fiber and prebiotics can really backfire. So this is a way to sort of ease into this process and really, help this process along. With hang on, I'm just seeing another question come in here. I'll get to your Dr. Tilly. I'll get to your question in a second. I'm doing many things here. I'm not used to all the technology, but yes. So Also, if you have a client that says, I can't eat fiber, that usually means their fiber fermenting bacteria are really low. So you actually need to slowly increase their fiber. I go into that in the course. Let's start with another question over here. Sarah says, I have got H2 under 10. I cannot tolerate any pre or probiotics. Do not understand why I can't tolerate. I can have banana. Any other advice, please, to build up the biome again? That's exactly my point. I just mentioned that. So you have a lot of bacteria in your microbiome that ferment, that live on fiber, right? They love fiber. And a lot of people have reduced their fiber intake. It's actually, if you are, I don't think you are on a standard Australian or standard American diet, which has something like, less than 10 grams of fiber. Whereas the normal amount of fiber is about 25 to 30 grams a day. And that even is what I would say you need more fiber than that. So a lot of people just chronically undereat fiber. That's a big problem with these westernized diets. So, but again, in addition to that, if you have a really disrupted microbiome that is really missing a lot of species that know how to ferment fiber, you're going to get a lot of problems. So this course goes into how to make grains and legumes specifically more digestible, and starting very slowly, and then also which prebiotics to start with. And what you're going to see is, and the reason I've called this course Restore Your Microbiome, how to regrow the garden in your gut, is because that's what you're doing. You're rewilding and you're regrowing an entire ecosystem, and that takes time. So don't give up. It does. Just be patient, and it will happen, but you have to kind of know what you're starting with. And that's why I do recommend a really comprehensive test like the Microba test. They're here in Australia, but they ship internationally. So I'll put the link in the comment section a little bit later on. But basically, I really think that's a very helpful test if you know how to interpret it, which I go through a lot of the markers in the course. Okay, Dr. Tilley, sorry for the wait. I have a client with methane-dominant Sibo. He is very constipated. Would you recommend him to stop his medication for constipation in the phase 1 cycle? So this is a really specific question about EMO treatment, right? So I'm actually really hesitant now to call just a high methane Sibo, especially a high methane that's high throughout the test. I think there's a lot of factors at play. And we're now moving more into the nomenclature of EMO, or intestinal methanogen overgrowth, which is not necessarily Sibo. So first thing is keep giving him things your patient things that will help move the bowels until your methane has come down. I do address also large intestinal methanogen overgrowth in this course. So you might actually find some very helpful tips in this course as well, or your client. So yes, I don't stop anything that keeps the bowels moving. And whether that's magnesium oxide, which is one of my favorites for people that are very constipated, because it doesn't cause dependency. So yeah, that's what I would recommend. I have a few more minutes here. Where's my timer here? Yeah. Wendy, I'm facing possible gallbladder removal due to possible polyps, as supposedly seen on abdominal ultrasound. Due to when these polyps grow quickly, and the surgeon recommendation is removal of gallbladder due to higher risk of malignancy. And I'm just trying to get to your questions here. My question is, does gallbladder removal have the impact of making Sibo more likely and also affect the microbiome of the small intestine? Good question. So, you always have to look at risk versus benefit when you have to undergo surgery, right? So if anytime, I cannot give medical advice on an Instagram live. I don't know the full story, Wendy, but the question about does gallbladder removal make Sibo worse? No, I've not seen that, but it can, because it can cause imbalances to some extent of large intestinal microbiome, because what happens is oftentimes you're just sort of indiscriminately releasing bile rather than just in response to food, because you don't have this functioning gallbladder that just is like a soap dispenser that squirts out bile. So a lot of times people get diarrhea, because bile acid diarrhea, because they have just indiscriminate bile, but that's not universal, right? A lot of people have no problems whatsoever. But gallbladder removal can affect the microbiome, because now bile-loving bacteria can take over or overgrow, and that can lead to hydrogen sulfide production and things like that. Hope that helped. But I do think microbiome restoration is very helpful, and to understand how that can occur. I have a little needy dog. One moment. Come on, Ben Ray. I've had IBS for years due to overuse of antibiotics. Treated Sibo and was better, than recently had a bout of norovirus. Now my issues are worse. Months later, and I'm testing positive for celiac via blood test when I haven't in the past. Can this help? First of all, the answer is yes. This can definitely help, because you've had lots of antibiotics. Anyone listening to this recording or to this live, yes, if you have gut issues and you've had tons of antibiotics in the past, or you've been on other gut altering medications like chronic proton pump inhibitors or acid blockers, if you have been on chemotherapy, if you had a lot of stress in your life, and your gut is not well, if you have a lot of systemic inflammation, all of us have to some extent a compromised microbiome, and we need to do everything we can to help restore it, right? So yes, the answer, Ashley, is it would be good for you to also just understand more of how you can help yourself, right? This is what I'm kind of all about, and my courses are about. It's about understanding how you can help yourself. My ileum and ICV, this is last question. My ileum and ICV, or ileocecal valve, which is the connection between your small and your large intestine, have been removed due to a bowel obstruction. I think I had undiagnosed IBS prior to this. I have had food poisoning too, many antibiotics. Can you help me? Low FODMAP has helped, but I have difficulty reintroducing them. I'm worried I'll have chronic Sibo due to lack of ICV. I've tested positive for Sibo, but doctor says Sibo tests are very inaccurate because of my short gut. That is true. So I would say, yes, I mean, that this is more of quite a complicated situation, because you've got a number of problems with potential adhesions and missing ileocecal valve. So this is more of a really specialized situation that you need to treat accordingly. I still recommend looking at the microbiome course to understand, but you are more like short bowel can really be a problem with Sibo. So, but understanding how the microbiome works, it might still be really helpful. You might also want to look at the Sibo success plan to give you more understanding as to the different types of treatments that are available for you. And not just antibiotic after antibiotic. So there's a lot of things there for you. All right, so the microbiome restoration, or restore your microbiome course has launched. I'm really wishing you all the best with your regrowing strategies. I hope you will find the course useful. We really have left no stone unturned in terms of what we wanted to put into this course. It has a dispensary guide that gives you tips of what to buy wherever you are. I have patients in America, in Australia, all over Europe. And so I know what kind of products I've recommended for people on all those continents. So there's product recommendations. There's a booklet that comes with the course that has lots of recipes. So there's a lot of great bonuses. And yeah, I'll probably do another live in a couple of weeks or so. But uh, I wish you all the best with your regrowing strategies. Now I've got to figure out how to